Oh, yeah, I take questions. I'm sorry.
In your healthcare proposal, they have two systems, and you pick one or the other. How does that address the number of people who are currently uninsured? Because they wouldn't, currently they're not able to buy into the public. Why would they be able to be buying into the public?
Yeah, that's a really good point. I should have said more on that. I started thinking there's two separate issues. Well, there's probably more than two, but I'll just make it two separate issues for now with healthcare. One is establishing an efficient system that will allow you to control cost, and for that you need, you know, something like a single payer type system, a universal Medicare system. The second issue is making healthcare affordable for, you know, low and moderate income people who can't afford it. The only way you can do that is with subsidies. So you will have to have, you know, basically full subsidies for the lowest income people, you know, figure out where the exact cutoffs are, and then substantial subsidies for people with, you know, more moderate incomes, you know, and you'd have to probably get fairly high up the scale till you have people paying the full cost of their health care. Of course, if you squeezed out a lot of the inefficiencies of the system, I've seen some estimates that have the administrative fees of the U.S. system going over 30% of our cost. By comparison, in Canada, it's about 3%. So there are a lot of inefficiencies there. So if you squeeze those out, you could certainly make healthcare a lot more affordable that way. But there's no doubt about it. You need to have subsidies for, you know, certainly the lowest and a lot of moderate income people.
What do you think of the Massachusetts system?
As best I can tell, it's a complete disaster. That looks like, you know, they're throwing epicycles on epicycles. I mean, they don't have. They're going to have huge problems with cherry picking. You know, basically, no one wants the really sick people. They're counting on the government being able to force private insurers to accept really sick people. They're requiring people, you know, for people who aren't familiar, Massachusetts is supposed to give universal coverage, and the key part of the story is that they have an individual mandate. So you get a penalty if you don't get insurance coverage. But part of that story, if you actually look at what that penalty looks like, they have subsidies for the lowest income people, but it is for the lowest income people. So you can have a person, I won't swear by these exact numbers, but you could have a person earning $20,000 a year that would be obligated to spend, I think it was about $200 or $300 a month on insurance, and they would, and the insurance has, I think it's a $2,000 deductible, and on top of that, relatively high copays. So what that would mean for someone who's not a terribly high-income person, earning $20,000 a year, is, you know, pretty high tax that you'd be obligated for with, you know, in many cases, very little benefit. So, you know, I think that might be a hard thing to actually implement. So, on both sides, on the one hand, dealing with insurance companies trying to avoid the sickest people, I don't think they have mechanisms in place that will eliminate that problem. I think they'll solve a very big problem that way. They've done nothing on the administrative costs. They've, if anything, probably made them higher. And then on top of that, you're going to have a very awkward situation where you're going to have a lot of people that decide they aren't going to comply with the system, and then at the end of the year, the state's going to be left in a situation, what do you do about this? Originally, in the first year or two, I think they just would lose a tax subsidy, but in later years, they would actually pay real penalties, and I'm really not sure that will be very viable politically. So I don't see it getting to universal coverage or anything like that, and I wouldn't be surprised if in a few years they end up, you know, just repealing it. It's interesting, I don't think Romney has made a big point of running on that in his presidential campaign.
In terms of encouraging creativity for medical discoveries, it seems to me that it's such a very difficult job that very few people might be successful. But you really need a razor to the throat kind of incentive system for years of research by very smart people that might turn out to be wrong. And then all that research is wasted. And the idea of sort of paying them to research month by month, almost irregardless of whether they come up with something, sounds more fair. But I think there might be a problem in that the number of discoveries of brand new ways to treat people would go down. With patents, they run out after a while. Okay. And you know, okay, go ahead.
No, I don't want to pick you up.
No, that's okay.
Okay, well, a couple points. First off, we already have the example of the National Institutes of Health, which does actually have all sorts of path-breaking research that, you know, there's any number of people who have gotten Nobel Prizes, you know, based on research that was financed through NIH. So clearly, some great breakthroughs can be financed that way. Secondly, I don't think there's any To elaborate on the proposal, my favorite proposal. The prize proposal, you actually would still have that reward system. So it really wouldn't change anything. So, Stiglitz's mechanism where you would have basically patents put in the public domain, but people would get cash awards based on how useful their patents end up being. Whether they were used by lots of people, extended. So you would preserve basically that same mechanism. But the proposal I prefer is one that would have direct public funding, and I'm perfectly fine with having it contracted out. I would, on top of that, have some portion, I'm pulling a number out of the air, let's say $1 billion a year, that would be devoted to providing prizes to individuals or teams that had outstanding efforts, which I think is more useful for two reasons than either a prize system or the existing patent system. First off, it would encourage openness, because a condition of getting the money is everything is open. So if you get public funding, you have test results, they're immediately in the public domain. You won't watch someone be done. You didn't write it up the next day. But the point is, in a timely manner, they're in public domain. That's very important because there's a huge amount of duplication, unnecessary duplication. I mean, it's fine to have people, you're working on a cure for this type of cancer, and someone else over there is working on a different method, and that's fine that you compete. But the point should be, well, suppose you were both working on the same method, and you found out that this is a dead end, and this other team over here has no idea, so they're spending hundreds of millions of dollars going up the blind alley. Well, it would be to everyone's benefit if those people knew that's a dead end. Okay, so the patent system inevitably leads to that sort of wasteful effort. I should also point out sometimes it's even worse than that, in that much of the research that we see today is developing copycat drugs, which is simply Pfizer comes up with Claritin, and people see, wow, that's a big blockbuster. If I can break in on that market, I don't necessarily need anything better, but I just want part of that market. So if I can develop a way to work around your patent, then I make lots of money. That doesn't do anything for society, but it can get, someone lots of money. The other reason why, I just say I prefer a system of direct funding to sort of that prize system is that in the prize system, at least the Stiglitz has laid it out, and not him alone, other people have written that also. You do have, I think, a very big problem. It's basically an all or nothing proposition. So, if you're Pfizer and you're Merck or you're whoever else, and you're trying to get a chunk of this prize money, and if you don't get the prize money, you basically get zero. So you've been doing all this research for a long period of time. Well, that gives you an incredible incentive for, trying to buying up payoffs to the people on the patent board or prize board, and cheating and lying, and as a practical matter, it's often going to be very, very difficult to say who really did the great breakthrough. So maybe you came up with the drug, but this team over here did 95% of the important work. You just ran down to the patent office and got the patent on it before they could do the final 5%. Well, that doesn't make any sense. Give you it all and give them nothing. So I think if you had a system where you had competitive contracts, and if someone, my vision of this is, you have large amounts parceled out over 5 or 10 year periods, and then comes up for renewal, and they say, okay, what did you do? You got $15 million to do research over 10 years. Show us what you did, and if you don't have a good track record, you don't get renewed, or maybe you only get 2/3 of the money. And if you did a great job, well, fine, give you 20. But then on top of that, for individual researchers, if they've really done some real path-breaking work that's allowed many more people with cancer to survive, whatever it might be, give them 10 million, give them 15 million, have a separate pot, And again, that, I won't say that always goes to the right person, although prize doesn't always go to the right person, but there's less at stake in that story.